I'm an adolescent medicine physician and researcher at Indiana University, and I focus on teen pregnancy and STD prevention and on issues of ethics and justice with youth. A lot of the work on pregnancy and STD prevention that I'm doing is implementing programs, understanding implementation challenges, and bringing sort of evidence-based programs into Indiana communities. On the ethics side, I'm really interested in issues around social justice and around adolescent confidentiality and capacity, sort of treating adolescents as sort of functional human beings. And that probably should be edited out. But, I'm really interested in human rights-based approaches. So I want to look at thinking about adolescents' essential rights as a person, thinking about their rights to health, thinking about their rights to health information, and bringing these sort of social justice and human rights-based approaches to my work in pediatrics. The other thing that I do is, as a pediatrician, I take a developmental approach to what I'm doing. So I like to think about what young people's needs are across adolescence, and meeting those needs. My ultimate outcome is sort of a happy, healthy, productive adult. And I'd like to see sort of the way like healthcare programs and communities rally around young people to provide them with the supports to do that. So I have always wanted to be a pediatrician and thought of myself as a baby doctor for many, many years. And then two things happened when I was in medical training. The first is that I was exposed to mentors in adolescent health who were these incredible human beings that were working to make adolescents' lives better and working not just in clinical settings, but in policy settings and public health settings. So a really strong mentorship in adolescent health. And I'd like to give a shout out to Dick Brown in San Francisco at San Francisco General, who was really just incredibly helpful and to me as a developing physician, and Don Schwartz at Penn when I was a medical student. The other thing that happened is I'm a real data head. I'm really interested in the health of communities. And as a pediatrician, when I looked at health indicators, it was adolescents that actually had the worst health indicators. I mean, there was the greatest need, the greatest unmet healthcare needs were in adolescents. So if I wanted to do work on a public health or community level, then adolescents were the group that I should be working with. And the final piece is that as a pediatrician, I found myself like the issues and language and community focus of the work being done in adolescent health was a really great fit for me.